Hi everyone, so just to introduce myself, I'm Victoria Furphy and I am the Chief Clinical Information Officer for the Community Division, and I'm also a speech and language therapist in the community. So today we're going to give you some information about Share2Care. You might have heard it called different things. Within Alder Hey, we're probably more familiar with it being called e-exchange. And we're going to go into a little bit more detail about what clinical benefits it can offer you. I think it's really important that during the COVID-19 situation, what we've found is that we've had a lot more participation from GPs and our primary care services. So now we've got over 95% of those services who are accessing the Share2Care. So it means that we can see a lot more records as well. So that was one of the key benefits that we wanted to discuss today and just show you how it works. So we've got a few different clinicians from some other trusts, as well as some clinicians from Alder Hey, and we're going to go into a little bit of a demo as well to just show you how you can access it and how it works. After today, we're going to send out a survey as well, if you have some time to fill in, just to get a bit of an idea on how much you're using it at the moment, or if this training's been beneficial and whether it would encourage you to use it a little bit more as well. So I'll pass on to Martin now, who's going to introduce himself and give a little bit more detail about the project as a whole.
Thanks very much, Vicky. Thanks. So I'm Martin Wilson. I'm a neurologist at the Walton Centre and I'm CCIO there. And but I'm also CCIO for Cheshire and Mersey, which is the main reason I'm here today. Thanks very much for inviting me to your Grand Round. I can't see you all, but it's nice to be here, and it's great to be at Alder Hey. So I wanted to say a little bit about Share2Care overall, and then a bit about e-exchange. So and my involvement in it. So as Vicky said, you hear these two terms. So Share2Care is a quite a big program across the whole region about information sharing, and it's got several different work streams, and e-exchange is one of those, and it's the front end that we'll see as clinicians. So perhaps the most important for most of us, and it's what's going to be the focus of this morning. But it covers Share2Care is a bigger program, covers other things about information governance and consent across the region, about population health, about public engagement, and so on. So it's a bigger program, but e-exchange is really the front end of that. It started a long time ago, this, and with something called iLinks years ago, which was to try and get this off the ground, but it floundered a bit for various reasons, and it really picked up when Alder Hey got involved as a GD, a global digital exemplar, and since then, there's been great progress, and this is where we are now with an actual platform that we can use as clinicians to benefit our patients. Why do we need this? I think that's hopefully self-evident for any clinical staff here, isn't it? But I think we all know, particularly those of us that work in specialist trusts, but not just that, that our patients don't respect geographical or organisational boundaries, do they? Their care is split across lots of different sites in primary, community, secondary, tertiary care, and if you want to make the right decisions and look after them properly, you need all that information, and so often it's not there, is it? I think we all recognise that, and this project is all about trying to solve that problem. You're going to see the platform later, but what can you expect? What's on it? So it's hospital discharge letters, clinic letters. There's links to primary care summaries, so medication and problem lists from primary care. There's going to be lots more content coming through, social care, mental health crisis plans, and more and more. And more hospitals are going to be coming on board with this, so that the amount of content you're going to see on there is going to get bigger and bigger. And it's actually shared across a much bigger footprint even than Cheshire and Merseyside. You might hear more about that later, but it covers Lancs and Cumbria as well. So there really is going to be lots and lots of content on there. To help us look after our patients better. I'm in clinic now, so that's one of the reasons I can't be with you for very long. So I'm in my regional MS clinic, so I'm going to be using it numerous times this morning. I'll give you one quick example. I saw a patient last week who, I had a referral letter, very nice referral letter, but this is a patient who'd had lots of care in another hospital at the Royal. Lots of admissions there, lots of investigations, seen lots of different specialists, and none of that would have been available to me, but I was able to access all that, as well as all the extensive medications from the primary care record by going onto eExchange, and it made the whole consultation just much more effective and easier for me. So easier for me, but also much better for the patient. That just wouldn't have been possible without access to the platform. And I think we all recognise cases like that, day in, day out in our practice. So that's mainly all I wanted to say, except for, big plea, obviously, to use it. I think you're going to see some great examples later about what it is. We're very lucky in our trusts to have very good embedded access to this in our EPR, so it's easy to use. There's no separate login, no separate consent process. So please use it. And the other thing I wanted to say was that we often get requests, don't we, for access to our patients' records from other trusts. Can we have the old notes, the old letters? So this is the other great use for this platform. We should be able to push back to people when they're saying things like that, say, well, you don't need that. Have you checked the Share2Care platform? It's all on there, and gradually, people are going to get used to using that instead, and that's of course going to get more people using it and signing on. So please do promote it in that way as well. That's, I'm afraid, all I've got time to do today. I'm going to get back to my clinic, and I will definitely be using eExchange in that clinic. So I'm going to hand over to our next speaker this morning. Now is Mona Fung, who's a colleague, an ED consultant at the Royal. If I can still call it the Royal, I expect you still call it the Royal, who's going to talk to you about her experience of using it in her specialty. So sorry I can't stay with you for the rest of the morning, but thanks for inviting me again, and enjoy the rest of the morning. Thank you.
Thank you, Martin. Hello, my name is Mona Fung. I'm a consultant in emergency medicine in Liverpool University Hospital Trust. And so I'm calling that Liverpool University Hospital Trust rather than the Royal, but I do work on the Royal side. And in our department, we do see quite a lot of young patients between the age of 16, 18, or maybe 19, having their long-term conditions still managed in LDH. So I'm just going to talk about my personal experience. So recently, we have got a 16-year-old brought in with an asthma attack. She was pretty breathless and also very upset at the time. She was not able to complete sentences, not really able to tell us much about her history, apart from saying that it's my asthma, it's my asthma. In emergency situations, we are quite used to lack of information. And what we did was we started her on the emergency treatment for asthma. And when I log onto a Royal system, because that's what we normally do to do the clocking, but because the patient has never been to us, we had literally no information about this patient. And because of COVID as well, her parents was not with her. In fact, this lady, she was with her friend. She was in her friends actually at the time. It was because her asthma kicked off. That's why the parents ran for the ambulance. It was actually before the local lockdown, so it was allowed. So the patient actually was on her own. However, actually, by logging onto the eExchange system, I could see discharge summary and also clinic letters from LDH, and then realized this lady, apart from actually asthma, she has got epilepsy as well. And I could see actually from on eExchange, because of all the letters, she was actually quite frequently needed to go to LDH and for emergencies. Although most of the time, once she had the treatment, she was better and discharged. And from the respiratory letter as well, and there was actually quite a lot of good information. It was actually help clinician. It was helping the patient for her care. Because as I mentioned, this lady was suffering from epilepsy as well. I was able to get onto a primary care record and to look at what medication she was on. Because it's very important, as we all know, patient.
Sorry about that. I think we've lost Mona at the moment, the joys of technology. So I think while we wait to see if Mona can join us again, I'll pass over to Zoe to give us a demonstration. Is that okay, Zoe?
Hi. Yes, hi, you okay? Thank you, Vicky. Yes, I'm hoping we get Mona back, the joys of technology, as you say. So my name's Zoe Huston. I'm one of the clinical implementation managers over at Share2Care. So I'm a nurse by background and also a health visitor, so been around for a while in different settings. So my role within Share2Care is to really blend together all our clinical work streams and make sure that our technical and our clinical workflows really come together so that we can deliver you the platform that you need to be able to do your role. So thank you very much for having me along today. So what I'm going to do is I'm going to play you our training video, which will be available to you after. And this will give a short recap on some of the things that Martin has explained and Vicky, and also show you what's available and how you can access not only the shared record, but into the primary care record and go through some of the details. So I'm going to just share my screen now, and this will enable me to show you the video. And Helen, if you're okay to, yeah, great, thank you. And you should be able to hear the sound now. Okay.
Welcome to this video tour of Share2Care eXchange. The Share2Care eXchange programme aims to join up digital services across Cheshire, Merseyside, Lancashire and South Cumbria to improve communication between health and social care workers. Share2Care works by allowing the health and care workers that use it to have controlled access to view certain types of patient information that is held by different health and care organisations located across the region. This is an approach which wasn't possible beforehand, as important information held in one part of the NHS system was not always immediately made available to health and social care teams in other areas who would benefit from seeing it. In the light of the COVID-19 pandemic, Share2Care is even more important now than ever, because it breaks down organisational boundaries and helps to better connect health and social care workers across the region. This will help to ensure that as the situation escalates, personal medical information is available to the right professionals in the right place at the right time, so they can make a more informed assessment of patients, regardless of factors such as age, resulting in care that is safer and more effective for all. eXchange is available to clinicians who provide direct care to patients across Cheshire and Merseyside. Lancashire and Cumbria is anticipated to be connected by the end of April 2020. Clinical roles have been mapped against information sharing framework to ensure that clinicians have the information that they require at the point of care. At present, the following trusts publish clinical documents in the exchange: Alder Hey Children's Hospital, Liverpool Heart and Chest Hospital, Clatterbridge, Royal Liverpool and Broad Green University Hospitals, the Walton Centre, St Helens and Knowsley Teaching Hospitals, Wirral University Teaching Hospital and GP practices. Please note that the exchange may not have every letter that has been sent via the above trusts. In addition to this, the following trusts can view the shared record, but currently do not publish clinical documents into eXchange due to their digital maturity, which remains in development: Liverpool Women's Hospital, Aintree and Merseycare, soon to be joined by North West Boroughs and Warrington. When prompted to log in to Share2Care eXchange, use your network account username and password. Once in the Share2Care screen, use the ID field to enter the ID number of your patient. I'm using the NHS number here, so I need to make sure that I have selected NHS rather than my local trust ID. Click the search button. All available documents for your patient will display. The eXchange view is broadly divided into three sections: medical documents, filters, and primary care information. Trusts publish their documents to eXchange. The documents have a number of tags associated with them that support the filtering of documents by outlining which trust published it, describing what type of document it is, and displaying a number of other identifiers relevant to its description. All documents published for a patient will display, but use the filters on the left-hand side if you wish to change the view. For example, here I can just select Alder Hey documents or Royal Liverpool and Broad Green University Hospital documents, or I can say I'd like to look at Clatterbridge and St Helens and Knowsley. Show more will show you more options. In the same way, you can select by document type, a clinic letter, for example, discharge notes and inpatient discharge letters. And again, show more will give you more available options. To view a document, you simply click to open it on screen. The document opens, you can scroll through. Click on the Medical Documents tab to return you to the documents list. Let's look at a clinic letter. So here this is a demonstration document, but here we can see that we can use the next page, previous page, and we can change the zoom if we need to. Again, click Medical Documents to return to the list. The Primary Care button shows you the GP record. The information within the available GP records is real-time and will be up to date where available. If the GP's record is not available via eXchange Share2Care, there may be a number of reasons why. For example, GP practices not activating sharing agreements, patients refusing to share their record, or for technical reasons. The GP record is broken down into 10 views with an additional view for Electronic Palliative Care Coordination System, EPACS. Just click through the headings on the left-hand side to view the information from the GP record. The practice will show the current practice for the patient. Patient detail will display automatically. Click Diagnosis, Events. If you've got any encounters, referrals or admissions, examination, investigations, so you can see recent tests or choose one of the other categories. Medications shows you the current medication for the patient, but also you can look at past medication or any medication issues. Problems, current problems and past problems. Any procedures, any risks or warnings. So here we can see the patient has allergy to peanut and penicillin. The summary will show you current problems, current medication, any allergies and any recent tests. EPACS is the Electronic Palliative Care Coordination System. This will be available for all patients that have a GP record available within eXchange, regardless of whether the patient is on an end-of-life pathway or not. This view is aligned to the national data set and is a view of which of these codes have been entered into the GP record only. There are a number of information tabs. So across the top here we can see all the information tabs that are available. Just click to view the information that you would like to see. When you've finished viewing the primary care documents, click the close button to return to the main screen. Many trusts view this the Share2Care record via their patient administration system. So here, this is the Meditax system used by Alder Hey. So medical record number, just search for your patient in the normal way. Select your patient. In the Physician Care Manager view, ensure the summary button is selected. Then at the bottom, you'll see the eXchange button. Click the eXchange and that will take you into the same list with the patient already selected, so there's no need to search. This works exactly the same way. You have your filters down the side. You can click to open documents. Here's a discharge summary. Back to medical documents. You can click to view a letter. Back to medical documents.
Hi. Okay. Thank you. I'm just checking that I'm live. Okay, I'm just going to go with that I am. Okay. Yes, I am. Sorry, I've got my hello. Welcome back, everyone. Thank you very much for taking the time to sit and watch the video. I hope it was really useful to you. As you can see, you know, we've got lots and lots of filters in there. We can really, you know, you can filter down to exactly what you want to see with our clinic letters and discharge summaries. It's got a wealth of information in there, and with all the with the summary view within the primary care record, you know, there's a lot of information that can really help your patients and you with your decision making. One of the things I just wanted to highlight is that I'm really aware that in Alder Hey, not everybody uses Meditech, and as you can see, you can access it without using Meditech. So for our EMIS users, or if you wanted to go in a different way, Alder Hey has a shortcut in our little shortcut folder on your desktop with e-exchange and Share2Care in there, which is how you would access it, and then use your filtering options as the lovely Shirley demonstrated to us in the video. So I think for me, what I really wanted to stress today is, you know, this is evident to us that we've got a lot of information available, and really, as Martin said, pushing back to our fellow clinicians, colleagues, and speaking to your admin staff and your PCOs and saying to them when people are ringing and leaving messages for information, pushing back to say, have you checked the shared record? Is the information in there? Have a look yourself, and if you can see that information in there, then you know your colleagues do. Highlight to people that is actually out there to them, and even maybe include it on some of your answer phone messages, you know, to say, have you checked the shared record before you leave a message requesting information on our patients. Okay, so I'm going to hand us back over to Mona just briefly after our network issues for you to carry on, Mona, if that's okay.
Hello, sorry about my network problem earlier. I think actually I was nearly done. So back to my patient. Actually, I remember she was the asthma lady, came in with an asthma attack. So, and after actually giving her the asthma treatment, so when I actually log onto the e-exchange system, you can see actually and clinic letters, discharge summaries from Alder Hey. So, so I was able actually to give her and have better idea of her and help me as a clinician, and also help her as a patient to give her the most appropriate treatment. And also with her history of epilepsy as well, I was able to get onto the primary care record to look at what medications, regular medications she takes, make sure that they're prescribed. And because the plan at the time for this patient, I was admitting her, and because that was the first time she was in the Royal, she was admitted under the medical team for some further observation. So just to make sure that actually in the evening she was actually getting her regular medications, her anti-epileptics. So it would be actually really bad if she came in with an asthma attack and ended up actually having quite a few fits as an inpatient. So that was my personal experience, of course. And that was an example on the young patients, but we do use that actually. And in my department, myself, my consultant colleagues, and all the junior doctors, we use that every single day. Whenever we actually clock a patient in, when we see a patient, to see what are the information available on the exchange, because Mercy is quite a small area really. When we've got so many hospitals around, it's not uncommon one patient actually despite their say is within the Royal catchment area, they goes to other places like Liverpool Heart and Chest and some specialist centre, and Liverpool Heart and Chest, Wharton Centre, Catterbridge, and of course sometimes they go to Aintree, to Wiston as well. So we'll be able to actually look at the share record, look at other clinic letters, discharge summaries, or any other correspondences from these hospitals to give better care for our patient. So that's me done. I think actually I am going to hand over to Tracy.
Good morning. Can you just pop your video on, Tracy?
Apologies.
That's all right.
For those of you that don't know me, my name is Tracy Shackleton. I'm the Major Trauma Coordinator for Alder Hey. So I've been working obviously with the Share2Care programme for quite some time now. For those of you that know the trauma system, you'll know that Alder Hey covers an extremely large patch in terms of trauma children that are sent to us from feeder trauma unit hospitals. They come in from as far up as Cumbria, the whole of the Isle of Man, the whole of North Wales, and halfway across the country, with Manchester taking over the east side of the country. So what Share2Care really has started to try and deliver for us in a really positive way is some of the information that we require to support our accreditation really as a trauma centre. So part of us being a trauma centre is that we are able to hit sequins, that we adhere to standards, that we have high percentages for standard compliance, and also part of that is receiving best practice tariff for some of those patients that are brought into the trust. To achieve all of those things, and obviously to maintain our accreditation, means that we have to absolutely be able to provide accurate data and accurate information about that patient's journey from beginning to end. So information from on scene, information when they were taken to the nearest trauma unit, and obviously any information that is collated at that trauma unit, and then onward being transported to the major trauma centre, which is the pathway they go through. The difficulties we've had in the past is not really around the direct admissions, because if they're directly admitted to us, we do tend to get all the information handed over from the crews that bring these patients in, and therefore that's easily accessible to us through Meditech. But the patients that go in through trauma units is where we have always had a gap in our data. We know what happens on scene from the PRFs or the ambulance crew paperwork, for those of you that aren't aware of PRF. But then we lose a lot of data in the interim when they're taken into a trauma unit. As I say, the reality of it is that paperwork often isn't onwardly transferred to us with the patient. So what Share2Care has managed to achieve for us is that we are able to see any notes that are made within that trauma unit around the care of that patient, what has been done to that patient, and obviously that will only expand. I think obviously we've already been in discussions about the kind of information that we want them to document for us in the trauma unit. So now we've got the portal, we will be able to be a little bit more definitive about the information that we want them to collate for us, and that then will be viewable to us to make sure that we can provide the best possible care for that child. We are part of the Trauma Audit Research Network, which is a nationwide database on all patients' trauma. And as I say, I think Share2Care is only going to be able to enhance that data collection for us and make sure that we are collating really, really good information about trauma patients to certainly support accident prevention initiatives. And as I say, to make sure that data is absolutely accurate around these patients. So yeah, thank you to Share2Care for giving us the opportunity to work with them, and obviously to help us provide that and help us support us to certainly maintain our major trauma centre accreditation. I think I'm going to hand over back now to Vit.
Yeah, that's me. Fab, great. So just before we move on to the question answer session, I just wanted to specifically highlight for obviously my little community EMIS users, just obviously Zoe has already mentioned, but just to be very specific, that if you use EMIS, we have assured that you've all got Share2Care accounts. There was a little bit of a issue with that, sorry, e-exchange accounts, and there was a little issue with that a little while back, but you should all have accounts. So what will happen, as Zoe said, you'll go into your AH shortcut folders, find the shortcut, and then actually what I find is it automatically logs me in. I don't even have to enter my details, but if you did, it would be your normal login details. But if there are any issues with that, obviously log a job with IT if you can't get access at all. But we have rolled that out for all the EMIS users as well. So thank you everyone for coming today as well. It's just really, I think it's really interesting to hear how other clinicians have used it, because I think myself as a clinician, I really find it useful to be able to access GP records. Sometimes if I want to know, has a child been referred to audiology, I have to admit in the past I probably would have picked up the phone and rang the health visitor. But this obviously allows us different ways and actually saves time, because sometimes there's that pause in treatment while you're waiting to get that information from a health visitor or a school nurse, and you're waiting on that information. So it just means you can kind of make those treatment decisions a lot quicker. And I think the fact now that so many more GPs have signed up to it, I think is a real sell for this, and I just want to encourage it, especially with the possibility of where things are going with COVID again, being able to, people are going to be so overstretched again, so it's good to be able to access those records and not have to call people and wait for that answer. So I'm just going to pull up the question and answer session now. Poor Zoe's probably going to get a lot of these questions. So I'll start from the top. So it says, this looks great. Just wondering whether everything on MediSec is currently also available on eExchange. So I'll pass that on to Zoe.
Hi, thanks for the question. Great question. So currently, if they are MediSec letters that are clinic letters or discharge summaries that are on MediSec, then they are available. There are two of our disciplines that aren't. So that currently is community peds and also CAMS. Now that's just because when we first embarked on this, IG still had some issues with some of our more sensitive patients, and there is certain others that will not go on, and that's because we're not allowed to share the data on some of our, so things around HIV and pregnancy, gynecology, we don't share those information, and that's just a national standard. But we are working now with our with IG, Alder Hey and wider to add our mental health data on there, and also for our community peds letters to go on.
And just on that one, with our CAMS team, Zoe's doing a lot of work currently with our CAMS and with other mental health trusts to try and make these templates standard, so that they'll be very similar across services, which will mean that they'll all look very visibly the same, because I think sometimes one of the difficulties of looking at records is when they're formatted differently, it's harder to access that data. So the idea is if they're all formatted very similar, it'll be easy for us to scan and quickly access that information as well. So that's fab. And then we've got a question about the flu vaccine. I know the answer to this one. So if the GP has entered this on the GP record, then we will have access to know that they've had their flu vaccine. So that will be, I think, definitely, especially this year more than ever, to make sure that we know about that. Then there's been another question. I'll pass this one back to you, Zoe. So when are other centres coming online? For example, will Chester be able to join in the way that they can view even if they do not share data? And then there's a bit of a follow-up. And nationally, is the system being rolled out, or do different regions use different systems?
Okay, that's a really fantastic question, actually. Thank you very much for that, Lisa. So for our Cheshire partners, so they have a Cheshire Care record at the moment currently, and so our Share2Care record will be in the new year joining up with the Cheshire Care record, so you'll be able to view into the Cheshire Care and have access to that Cheshire information. And with Leighton, I'm not the best with geography, so forgive me. I think that just sits outside, but we are the way the LACRA programme works, which is our longitudinal healthcare records. So we've got Cheshire and Mersey, and we're connected with Lancashire and South Cumbria, and that makes up our North West Coast regional shared record. Okay, so that's one LACRA, but then across the rest of the country we're divided up. into other LACRAs. Okay, so they've all got their own shared record, and then we are moving towards our next phase, which will be to merge them all together. So the vision that we've got, and what everybody's driving and working towards, is that all of those LACRAs will connect up together. So you may have heard of One London or the Great North Care Record. So everyone's got a slightly different name, but because we've used a form of digital which is open standard, so what it means, it's a bit of a plug and play. So what you can do is basically get our shared record, and with an extension lead, we sort of marry them together, and that enables us to view. And we've proved we can do that by connecting to Lancashire and South Cumbria. So now it feels like one platform, even though actually we use eXchange and they have a different solution called LPRES. Together you view it as one record, and that is basically how we're going to do it across the country. So I hope that answers your question.
That's great, thanks Zoe. I'm really excited actually, because I think that's something that as clinicians we have all, and we can just see the massive clinical benefit of that being open, and and I think some of the GDPR changes have really enabled us to make some of those changes as well, which is great. So we've just had a couple of questions here. So someone's tried to log in and it's making them log in for each patient. I think on that situation, I would probably recommend putting in a job request for the service desk so we can look into that in a little bit more detail, because it could be specific per user. And we've also had another question saying that it looks great and how do we get access? So if you're a Meditech user, then you should automatically have your eXchange button when you go onto the patient. So you'll find your patient, see the eXchange button, and then click that and it will automatically launch the eXchange. So if that doesn't work, again, it would be a sorry service desk, I'm giving you a lot of work, but it would be a call to the service desk to look into that and see why it isn't working. And then if you're an EMIS user or someone who has an Alder Hey email address but doesn't use Meditech, then what you'll do is you should have an account, and it would be your email address and your login. So it'd be like for me, victoria.furphy, and then your password. But again, any issues with accessing any of these, please do put in either a job request through your icon on your desktop, or by logging a job with the service desk on the phone, and we can look into these and make sure you've got access. I think we're hoping to encourage people to access this. So what we don't want is that you find you can't access and then leave it for another day. So I often think that putting in the job request digitally on the service desk, I can do it in about 2 minutes and then it's done and someone will get back to me. But I think it's really great if the one thing you do from today is try and log in, try with a patient and see if you can access it, and find out you can't. In a way, that's a good thing for me, because you can get that sorted really quickly, and then we can get you accessing and get you having the full potential of this as well. Oh, there's been 2 new questions, sorry, I've just seen. So I'll just publish them and go on to them. It says tried to access primary care and coming up with request failed status code 500. I think I know what that is, but I'll pass that one over to Zoe.
Okay, so what we need to just probably highlight is that they are the GPs that are within the region. So if you're looking at a patient that's got a GP that's outside of the region at the moment, that's just a normal error message. So we are doing some review of the error codes at the moment so that will be more meaningful to our users. But what that means is that it'll be a practice that isn't within our region at the moment. And if it isn't, and it's different, please do log that to us, because we've got that many signs up now that there shouldn't be an error code. So it could be one of 2 things, but please, highlight it over to us and we can check.
Great. And then we've got another question asking about lab results or X-ray results on the system, or is it only clinic letters?
So currently, where we are on our digital roadmap, it's clinic letters and discharge summaries, but our radiology information and labs are really in flight at the moment, and we are going to be integrating those into the shared records in the near future. So watch this space, because they're next to come.
And then we've had another question saying, are Sefton GPs included? I can answer this one from my own experience, just being a Sefton speech therapist. There definitely are Sefton GPs on there, and I think there's quite a significant number of those now. So yeah, definitely should be on there as well. So I think for our community services, it's going to be really important for us as well, being able to access those GP records. Okay, great. And I think at the moment that's all of our questions.
I think
so
I'm on screen at the moment.
Yeah, no,
yeah. Can we hand back over to Vicky just to finish? If that's okay, Ellen. Thank you.
So just to thank everyone who's come and spoken to us today again, because it's really important, and I think it's particularly important to see how we're using it in Alder Hey. So thanks to Tracy as well, because I think it's really good to just see how it's being used within our trust. But also, our young people, they don't always come nicely just to Alder Hey as well. We have got a lot of hospitals in this area, so I think it is really important for us that we can gather that information from different areas as well. So we'll send out an email with a survey. If you wouldn't mind completing that, that'd be really useful for us to develop this further. And like I say, if I can plea for two things today, one thing would be please try and log on. And if you're having any difficulties logging on, please put that request in and get that sorted as quickly as possible. We can get you an account if there isn't one, and that's not a problem. And then my second plea would be just to encourage, start talking between services, challenge people. Have you checked the shared record? Because actually I think we spend so much time, and I think I think of my admin staff at times being inundated with requests from other professionals within Alder Hey at times, and actually if we can challenge people to be looking at that, the more you use a system like this, then the more natural it's going to be and the easier it's going to be to use it as well. We've just had a couple more questions. Sorry, they've just come up. So I'll just quickly, we've still got some time, so I'll just have a look at those. So it's from James, and he's saying immunisation records in relation to what has been given and what is required. Can this support that? So back to Zoe on this one.
Okay, so from immunisation point of view, we're not connected yet from a paediatric point of view to the child health record, which is sort of the main hub which holds all the information in relation to childhood immunisations and the schedule and what they're still missing. However, that information is sent to the GP. So the GP then will update that record, and within the GP record you can find the immunisation history. So although it won't give you the schedule, what's outstanding, you can still see what has been given to the child, as long as we are like anywhere, it's only down to what that GP updates in that record. So if you've got a practice that isn't turning around some of that information as quickly, we have no control over that. But the child health system and immunisation is definitely something that has come up again quite a few times, and we would be interested in looking to add that into the roadmap, particularly for our paediatric trusts and our health visitors and school nurses.
Great. I've just got another question about access and error codes for a Sefton GP access. So what I would say is our policy for Alder Hey, if there are any issues on Share2Care, is that we put those issues through the service desk and then they are sent to our Share2Care team. So it's absolutely fine to just log that as a job request like you would any other IT job request. So if there are any issues like that, please do report them, because if you don't tell us, we won't know that they're there. So it's great to just keep us informed. And it may be that there's a specific Sefton GP that perhaps hasn't signed up. There are only a few now. Like I say, I think we're at about 97%, but that is going to mean 3% that aren't. So yeah, if you could just log that as a job, then we can explore that a bit further. That would be great. And then we just had another request saying, could we just repeat the hospitals that are participating at the moment?
Yep. So from a live point of view, so from a live point of view, as in that they are publishing into our shared records. So we've got Alder Hey, we have Wiston, and we've got the Royal, we have Heart and Chest, Clatterbridge, and Wirral. Yeah, Wirral. We're all there publishing, and Aintree, Merseycare, and the Women's Hospital are viewing at the moment. Oh, and the Walton Centre, sorry, they're the other. How could I forget when we've had Martin on? And the Walton Centre are publishing. So there's just 3 out of the 10 trusts that are just viewing only, and that's due to their technical capability, you know, their maturity of their digital system being able to publish into the shared record. But we're working really hard with them, and we've got solutions coming. So what I'll do is we'll be sharing this video, but we can also share around the link just for the video as well, which will allow you to see them, and we'll put a screenshot of that with that link.
Fantastic. So I think we'll finish there because we've got no more questions now. Thanks very much. And of course, you know, feel free, if there's any questions about Share2Care as well, feel free to drop us an email and we can get in touch and see if there's anything we can do to help as well. Thanks very much.